Hello, I'm Susan Marlin, President and CEO of Clinical Trials Ontario and nominated Principal Investigator of Can Review. It's a pleasure to welcome you to the Health Data Research Network Canada's Pragmatic Trials Training Program, an exciting pan-Canadian program that's exploring innovative approaches to conducting clinical trials. Improving the environment for clinical trials is our focus at Clinical Trials Ontario. At CTO, we work collaboratively with industry, research institutes, patients, the public, and other health innovation organizations to strengthen the clinical trials landscape, helping to ensure that research is high quality, efficient, and impactful. Through initiatives like the CTO Quick Start program, we help reduce barriers and accelerate the startup times for clinical trials with innovative tools like the Ontario Universal Agreement for Clinical Trials, which is a standardized clinical trials agreement that simplifies legal and administrative requirements and minimizes the time and resources typically required for contract negotiations. Another area of focus is streamlining the research ethics approval process for multi-site clinical trials to make trials more efficient and competitive while ensuring the highest ethical standards. CTO's STREAM program improves the research ethics review process by enabling a single research ethics review for multiple research sites participating in the same study. Since establishing STREAM more than a decade ago, nearly 10,000 users, including 20 research ethics boards and 150 institutions in Ontario, have come on board. Now, a new pan-Canadian initiative is taking the concept of a single REB review across the country. Can Review is establishing a Canada-wide single research ethics review system for multi-site studies. Working with partners in all jurisdictions, Can Review is reducing provincial barriers to optimize the ethics review process and ensure strict timelines, making Canada a more attractive and efficient place for clinical trials, and more importantly, helping patients gain better access to innovative treatments and potentially life-changing therapies. This is an exciting moment for Canada. As a country, we have fallen behind. Many countries, including the US, UK, Australia, Brazil, Spain, Denmark, Indonesia, they already have nationwide ethics review systems in place. But now Canada can regain ground. By improving clinical trial processes, including research ethics review and startup procedures, we have the opportunity to increase Canada's competitiveness in attracting global clinical trials, expand clinical trials to underserved rural and remote locations, and improve equitable access to trial participation so that patients and families can benefit from trials and innovative treatments. Just as CTO and Can Review are working to create a more efficient and competitive clinical trials environment, the HDRN Canada Pragmatic Clinical Trials Training Program is equipping researchers like you with the tools and knowledge to lead successful trials in this evolving landscape. This program brings together scholars, physicians, and researchers from across the country to learn how to conduct pragmatic clinical trials that are faster, more cost-effective, and more efficient. Led by top Canadian experts, the program plays a crucial role in strengthening our ability to manage current and future health threats through high-quality research. Throughout this program, you will gain the knowledge and tools needed to conduct a pragmatic trial, from understanding the trial design and implementation to statistical analysis, quality control, and oversight. The curriculum covers 12 essential components, ensuring a strong foundation for conducting impactful clinical trials. Best of all learning modules are open access and publicly available, making this valuable resource accessible to all. This program is designed to support and empower you in advancing clinical trials that will improve health outcomes for Canadians, because that's what clinical trials are all about, getting critical, innovative therapies to patients and families faster. I encourage you to take full advantage of this program, connect with experts, engage with your peers, and apply what you learn to strengthen Canada's research landscape. Thank you for being part of this important initiative, and I wish you all the best in your training.